relax your body, try not to stress about it, which is very hard. And then you're going to eventually retake your blood pressure in an accurate way. My name's Lavonne and welcome back to my YouTube channel. One of the things that you can expect throughout your pregnancy, throughout your labor, and into the postpartum period is that they will be taking your blood pressure. So this is a skill that's important for life. They'll take your blood pressure really for the rest of your life. Even your child, they'll take their blood pressure. Blood pressure is one of those indicators. It's called a vital sign because it's one of those things that as a medical community, doctors, nurses, midwives, etc., it gives us a lot of insight into what is potentially happening in the body. And so it's important for you, one, to know how to take an accurate blood pressure, whether that be at home. If you're taking it on your own, you can do this on your own. You can get your own blood pressure cuff. I'll give you some recommendations down below for some links of getting your own, especially throughout your pregnancy. If there's any concern for your blood pressure, this is something you can do at home. But if you're doing it at home, you want to be doing it accurately. And so I'm going to talk you through what it looks like to take an accurate blood pressure. And then the other thing is that while you're in the clinic or in the hospital, it's also important that you know how to take an accurate blood pressure because you might not be taking it. Your nurse will likely be putting it on your arm and then pressing the go button. But you may also not know that by talking through the process or by crossing your legs or by having a full bladder, it can affect the blood pressure reading so that it's inaccurate and not exactly correct to give us an accurate view of what's going on in your body. A normal blood pressure for a non-pregnant person, and technically a pregnant person as well, but there's a little bit more leniency when you get pregnant that I'll talk about in a second, is 120/80. There's one number and then there's a line over, is how we say it, over the bottom number. The top number is the systolic number, and that's going to be typically higher. It should be higher than the bottom number, which is your diastolic number. And so their diastolic was 77. That would mean that the bottom number is 77. We need the combination of the two. It gives us information about the pressure going on in your body. If it's too high, the risk in pregnancy is for what's called a preeclampsia that can lead to an eclampsia, which is when you actually have a seizure. While you're pregnant, it's an emergency, not good. We don't want you having seizures. And then technically with a blood pressure too high, there's a risk for stroke. When you get pregnant, you add all this blood volume to your body and that pressure goes up a little bit. We have a little bit wider range for what's normal in pregnancy, also because we need that pressure and we expect that pressure to be pushing blood to your baby. And blood carries all your nutrients and the oxygen to keep your baby alive. And so we want your blood pressure adequate or enough, pushing the blood, but we also don't want it too high. We also don't want it too low. Too low of blood pressure, one, doesn't perfuse or bring blood and oxygen to the tissues, the most important ones being our brain and our heart and our lungs and technically everywhere, all our organs, because they need that oxygen, that blood to survive. But especially in labor, if your blood pressure drops, one, you're gonna feel really terrible. It won't perfuse your organs, which can happen for like a little bit, but one, you're gonna eventually pass out because your blood pressure is so low. And what we really care about is that you're always perfusing or bringing blood to your baby through the placenta. And so we need your blood pressure to stay up or enough to bring that pressure of the blood to the baby, all right? So this is really important. They will be monitoring your blood pressure so closely because of that preeclampsia risk. It's one of, if not the most common pregnancy complication that can happen. It can happen anytime throughout your pregnancy. Technically before 20 weeks, it'd be called something else. But if you have blood pressure issues at any point in your pregnancy, it's a problem. The only cure is birth. And so you may be looking at a preterm birth. I have other information about preeclampsia. I'll drop that video down below. You can watch that, learn all about preeclampsia, okay? So let's learn how to take a blood pressure, and I'm gonna talk you through on Sophia, one of our bundle birth staff here. If you recognize her, she's a part of our Coping with Labor class, which I'll link down below as well. The key here is you do want the right cuff size. I'll mention this, you want it on skin, ideally. So sometimes at the doctor's office, they will like put it over your shirt. Most of the time, as long as it comes out accurate, totally fine. But if it's inaccurate, you're gonna wanna say, you know what, why don't we just put it directly on my skin to make sure that we're getting the most accurate reading, and then I will talk you through exactly what it looks like to get an accurate blood pressure. So when you're ready to take a blood pressure, you wanna rest for 5 to 10 minutes prior to taking your blood pressure. If you're just running in and you've been doing a bunch of things and really active, you plop yourself down and you take a blood pressure, it's likely gonna be too elevated and inaccurate. So sit for 5 to 10 minutes. You also want to avoid caffeine, smoking, exercise for at least 30 minutes prior to taking your blood pressure as well. So if you've just been outside and came running through the door and been walking around the block or something, just sit and rest for a little bit. The other thing is you definitely want to empty your bladder prior to doing it, because if your bladder is full, it can actually create an inaccurate blood pressure. Now, when you go to sit, you want to sit on a chair or on a hard surface and make sure your feet are touching the floor. Now, if you look at Sophia right now, her feet don't even hit the floor with this chair. And so what I'm gonna do is I'm gonna slide a book under her feet so that her feet are resting on a firm surface. If they're dangling, that also can create an inaccurate blood pressure. So she's resting. The other thing is that her back is supported. Originally, we had this on the massage table and I was like, oh, we're gonna set it up and show them wrong. And so her back needs to be supported, feet on the floor, legs uncrossed. So if she was crossing her legs, she needs to uncross her legs. And then you're pretty much set up to take this blood pressure. So when you're placing the cuff, there should be a little artery note or like a line on the cuff that is where you align with the inside of your arm. So like where your elbow bends, and then you want to slide it up above the elbow crease so that it's snug on the arm. Then it's time to finally take the blood pressure. No pressure, Sophia. Her blood pressure will probably be a little bit high at this point. So you want the arm at the level of the heart. The heart is right about at nipple line, and so her arm is perfectly placed. You also want it supporting on a surface. So if you're maybe by a countertop, I'm gonna hold her arm here so that it's not just dangling in the open and it's not also sitting fully on her lap. It could be on her lap though, just like it is here in this shot. I will come in and I will support her arm, have her take a couple deep breaths. You kind of get a little excited before we press go, and then we'll press the start button. Most blood pressure machines are automatic. It would be completely unrealistic for you to have to use the old-fashioned way with a stethoscope and then the blood pressure like little device. I have one of those. I do know how to do it. I had to learn that in nursing school, but this day and age, most of everything is automatic. So it will squeeze you very tight. It will feel like your circulation is cut off because for a very brief second it is, and it's going to eventually give you a reading of what your blood pressure is.
Measurement over. Your systolic blood pressure is 117 millimeter of mercury pillar. Your diastolic blood pressure is 60 millimeter of mercury pillar. Your heart rate is 64 beats per minute.
Look at you, like a little perfect blood pressure. Now, if the blood pressure was high, I would ask you to just sit and relax, maybe do my peaceful visualization or do one of the visualizations from my visualization class. And just sort of calm your body, maybe check in and make sure the feet are supported, they weren't crossed. You're also not talking during the blood pressure. This is a good reminder when you're at your doctor's office that you're not talking during, and then you would want to repeat it another 5 minutes later. So what happens if you get an elevated reading? A normal, like I said, blood pressure is 120/80. Now, I said for pregnancy, we allow some leniency. So what's a normal blood pressure in pregnancy? Technically anything under 140/90. Okay, so it has to be under that. So 139/89 is still technically okay. Now, if you have that, you're going, what's going on here, right? Anything under that, totally fine. If you feel weird, if you ever have a headache, blurry vision, pain in your belly, you're having those symptoms, you've taken some Tylenol, you still have a headache, make sure you let your doctor know. And then if your reading is above 140/90, above or equal to that, then you're gonna wanna retake the blood pressure in about 5 to 10 minutes. So if it's that high, you're gonna sit, you're gonna just relax your body, soften everything out, try not to stress about it, which is very hard. And then you're going to eventually retake your blood pressure in an accurate way. If it is still elevated, even if it's not, to be honest, I'm still gonna tell you to call your doctor and let them know, but especially if they don't know that you've had high readings in the past, you're calling your doctor and just let them know, hey, I'm taking my own blood pressure, this is what's going on, they'll give you some recommendations. All right, now, when is it severe? When is it like, all right, let's head to the doctor / head to the hospital to get this looked into and get some labs drawn. The next step would be to continue to take serial blood pressures and then get some labs or some blood out and test for your PC ratio and some other labs to make sure there's no other kind of organ involvement. They may do a 24-hour urine collection. I talk about all of this in my preeclampsia video, so you can go there. But anything 160 over 105 and above, equal to that. So you get 160 over 105, this is bad. This is too elevated. You can still do the 5-minute retake because sometimes you're moving around, you're really stressed. That initial reading is extremely high for some reason, and if you're having contraction during, sometimes that will make it high too, but then you're taking it in between contraction if you're in labor, and then especially if it's still high, but if you ever get a reading that is 160 over 105, you need to call your doctor and then they'll likely advise you to go into the hospital, get checked out. Better safe than sorry. Ultimately, what I want you to remember is that your blood pressure is important. Do you have to go immediately right now and purchase yourself a blood pressure machine and be taking your blood pressure multiple times a day and be stressing out about it? Absolutely not, okay? But if your provider is concerned about your blood pressure, you've had some elevated readings, they suggest that you continue to take your blood pressure, write them all down in a log, bring that to your next doctor's appointment. Now you know exactly how to get an accurate reading so that there isn't more drama than there has to be, and we can actually treat you for exactly what's going on in your body. Also remember that there are a few things that can elevate your blood pressure. That's caffeine, smoking. Please don't smoke in your pregnancy. I know that might be a challenge for some of you, but do your best and talk to your provider because they can provide you with some support. Alcohol, which you shouldn't be drinking in pregnancy anyway, can all elevate your blood pressure. And then stress. So if you're feeling stressed about your pregnancy, if you're feeling stressed about your birth, your postpartum experience, etc., you have come to the right place because I'm gonna suggest for you to take the bundle birth class. I'll link everything down below, a coping with labor class. Knowledge is power. Just like you saw in this video, now you know how to take a blood pressure, and now you can go, all right, I know what to do. I don't have to stress about it. I know that I'm doing it correctly, and then you can continue there forward, and that's exactly what it's gonna be like for your birth. And so I will link everything down in the description box down below. Check out my other links, other social media, etc., and then comment what your favorite part about this video was. What was something that you learned that was new? Maybe if you had an experience of preeclampsia that you wanna share with others, comment down below. This is meant to be a community available to you where we can learn from one another. Everybody's experience is valid in that. Make sure you like, share with a friend, anybody that's like maybe stressed about this, and then make sure you subscribe so that you never miss a future video. And then until next time, don't forget to flex and flow, and I will see you so soon. Bye. Smoking. So then, I'm stuttering. It's like I got nervous about smoking or something. Yeah. Error! Okay, so you can put your arm in. Okay, that's not what I wanted. It's like I've never taken a blood pressure before.